This is adult assessment. So the first thing I'm going to do is I'm going to gather my supplies on my blank piece of paper and my pencil to write down vital signs and then the rest of my supplies here. Papa.
Hello.
Hi, I'm Amanda. I'm going to be your nursing student for today. Can you please tell me your name and date of birth?
Wayback 11/13/16.
Okay. Do you have any allergies?
No.
Okay. Okay, so the reason why I'm here is to perform a head-to-toe assessment on you. The reason why we are doing this is because we need to detect any medical abnormalities that may need some medical attention. A head-to-toe assessment is basically where I look, listen, and feel on all of your body parts to try to find anything that needs medical attention.
Okay.
Okay. Before I begin, do you have any cultural or spiritual beliefs that may impact my
No.
care? Can you tell me how you deal with stress?
I go to the gym.
Okay. How are you feeling in Washington?
Oh, really well.
Okay. Well, that's good. So I'm gonna do a set of vital signs on you. Now grab a blood pressure. This just squeezes your arm and tells me how hard your heart works. Do you have any implant medical devices on that arm? It's good that you go to the gym to cope with stress. If you eat enough protein, going to the gym can also help grow your muscles.
Okay.
So I got 110/70. I'm just gonna take your temperature. This goes on your head, and I'm also gonna get oxygen saturation on you. It goes on your finger, and it measures your oxygen in your pulse. 97.8. Just gonna measure your pulse real quick. I got 16 respirations, 92% for oxygen saturation, and 63 for a pulse. On a scale of 0 to 10, 0 being no pain, 10 being most pain, how would you rate the pain?
0.
A 0? Okay. So I'm just going to ask you some silly questions, but they do have a purpose. They help me assess your medication. So can you tell me who you are?
Where then?
Can you tell me where you are?
Not the husband.
Tell me what time it is.
Around 5:30.
Alright, what's the event going on? What's the
Patient assessment. I'm the patient.
So based on his answers to my questions, I can say that he is fully conscious. He's learn-oriented to person, place, time, and event. His speech is fluent and monotone. His mood is calm, and he is the effect is a relaxed body language, and his auditory acuity. He's able to hear me speaking at a moderately pitched voice. Okay. So now I'm just going to do my general impression. So he is sitting at a 45-degree angle. He's not distressed. He's wearing clothes that are appropriate for the weather. He appears well groomed and has adequate hygiene. He does not have any foul odors present coming from his body or his breath. Okay. So I'm going to look at your head. I'm looking at the size, shape, and symmetry. I'm also going to palpate for any deformities. Okay, now we look at your head. So his head size is proportional proportional to his body. His head is symmetrical. There are no deformities. And the shape is normocephalic. I'm looking at his head. His hair is evenly distributed throughout, and he doesn't have any infestations. His overall appearance, he looks like he's not distressed. He is relaxed and well groomed. So now I'm going to assess his facial movement, function, and symmetry. So can you smile real big? Can you frown real big? Can you stick out your tongue? So his face has a full range of motion. There are no deficits in his function, and his face is evenly symmetrical with no hemiparalysis. So now I'm going to palpate your sinuses. Are you tender?
No.
Okay. Non-tender, non-swollen sinuses on the frontal and maxillary. His overall appearance, well-groomed, and he is not in distress. And he's in calm state. So now I'm going to look at his eyes. So I'm just going to shine this light into your eyes. It helps me assess your
Okay.
reactiveness of your pupils. Okay. His pupils are equal round, reactive to light, and now I'm going to have you focus on this right here and then something behind it. Okay. His pupils are equal round, reactive to light, and accommodations. His eyelids are not swollen. His sclera is white, and his conjunctiva is pink, and his pupils are not fixed. And he doesn't have any nystagmus or strabismus present. So I'm looking at his nose now. His nose is symmetrical. Can you breathe through your nose? Well, okay. And his skin integrity of his nose is clean, dry, and intact. So now I'm going to assess his patency of his nares. So his nares are patent. Now I'm going to assess your ears. So I'm going to have you turn that way. So his skin integrity on his ears is clean, dry, and intact. There are no lesions, and the color is appropriate for his ethnicity. Now I'm going to palpate for tenderness. Are you tender?
No.
Okay, I'm going to put this gauze in your ear, and it helps me assess for drainage. There's no drainage present. So I'm going to do the other ear. So his skin integrity on his other ear is clean, dry, and intact. The color is appropriate for his ethnicity. Now I'm going to palpate for tenderness. Were you tender? So he was not tender, and now I'm going to put this gauze in to assess your drainage. There's no drainage present. Now we look the other way. His skin integrity is clean, dry, and intact. So now I'm going to assess his mouth. So his lips are pink and moisturized. Now I'm going to have you open up wide. So his uvulus midline, his mouth is moisturized. The color of his mouth is pink. His dentition is well groomed. He doesn't have any chipped teeth. There are no lesions present. His mouth is moisturized. Do you wear dentures? Okay. His mouth is pink. Uvula midline. No dentures usage. No chipped teeth. His dentition is well maintained. And his mouth is pink. Okay. So, have you had any problems with your mouth, your nose, your vision, your hearing?
No.
Okay. Have you had like any headaches?
No headaches.
Have you had any changes in your vision? Do you wear hearing aids?
No, I don't.
Okay. How often do you brush your teeth?
Every day.
Okay, that's good. So now I'm going to assess your neck. I'm looking at your trachea. Your trachea is within midline. There's no JVD present, no masses or go to your ear based on inspection. His lymph nodes do not look swollen. So I'm going to palpate your lymph nodes. Are those tender?
No.
Non-palpable lymph nodes, non-tender lymph nodes. Now I'm going to have you look that way. I'm going to assess your carotid pulse. Okay. Pulse is present, 2+, non-bounding, regular rhythm. So now I'm going to have you look the other way. pulse is present, non-bounding regular rhythm, 2+. And do you have any difficulty swallowing?
No.
Okay. Do you have any problems with your throat at all?
No.
I am going to palpate for masses. Are there masses or tenderness?
No.
Yeah, tenderness. Okay. No tenderness present, no masses or swollen lymph nodes based on palpation. Okay. So now I'm going to assess your upper arms. So I'm going to look at your skin integrity. Your skin is clean, dry, and intact, and the color is appropriate for ethnicity. His knuckles are swollen, and your fingernails are not clubbed, and they're well maintained. Okay. His skin integrity is clean, dry, and intact. The color is appropriate for ethnicity. His knuckles are not swollen, and his fingernails are well maintained. So there are no deformities present based on inspection of both arms. Now I'm going to do circulation. So he's warm to the touch, and his bilateral pulses are equal, 2+, and a moderate temperature. Okay, now I'm going to do your capillary refill. Capillary refill is less than 3 seconds on his left arm and all 5 fingers. Okay. Capillary refill was less than 3 seconds on all 5 fingers on his right arm. His muscles look equal and symmetrical in size. Now I'm going to assess your motor skills. Can you go like this for me? So you have fine motor skills present. Now can you squeeze my hand? Equal and symmetrical grip strength. So now I'm going to have you sit up. I'm going to have you do gross or big motor skills. So can you go like that, and then go like that. Are you experiencing any pain?
No.
Okay. So he had gross motor skills present, and now I'm going to assess for any lumps or deformities or swelling. Okay. Are you tender?
No.
Okay. There's no swelling, no lumps or deformities based on palpation. Are you tender?
No.
No lumps, no deformities, and no swelling based on palpation. So now I'm going to assess your sensory. So I'm going to have you close your eyes. I'm going to touch one of your fingers, and you tell me which one I'm touching.
Thumbs.
Okay. So his sensory is intact, and now I am going to ask you some questions. So have you been experiencing any stiff joints or pain in your upper extremities?
No.
Okay, do you have any concerns about your upper extremities?
No.
Okay, so now I'm going to assess his back. So I'm looking at his skin integrity on his back. So his skin is clean, dry, and intact, and the color is appropriate for his ethnicity. He's warm to the touch. There are no surgical scars, and his spine is within midline. And his color is appropriate for his ethnicity. So now I am going to palpate for tenderness and lumps. Are you tender?
No.
Okay. No tenderness, no lumps. Have you been experiencing any back pain recently?
No. No.
Okay. I'm going to assess your temperature on your arms. His temperature is warm as orange bilaterally, and so I'm going to have you lay back down. I'm going to assess your chest. So his work of breathing is even and non-labored. He has equal and symmetrical chest rise and fall. His posture is at a 45-degree angle. He is not tripoding or in distress. So now I'm going to look at his skin. So he has no port or pacemaker. His skin is clean, dry, and intact. The color is appropriate for his ethnicity. And I do see that he's not using accessory muscles to breathe. His breathing is even, symmetrical, and non-labored with equal chest rise and fall. Okay. Do you experience any chest pain or difficulty breathing?
No. I don't.
Any concerns regarding your chest? So now I am going to palpate for masses. So I'm going to palpate for masses. Let me know if you're tender. Are you tender?
No.
No masses. diastasis, no tenderness present based on palpation. Now I'm going to listen to his heart sounds. So he has aortic at second intercostal space, right hand side. Pulmonic, second intercostal space, left hand side. Herb's point, third intercostal space, left hand side. Tricuspid, fourth intercostal space, left hand side. Bicuspid or mitral on fifth intercostal space, left hand side. So now I'm going to listen to a maximum impulse for 60 seconds. So S1 and S2 are present. He had a regular rate and rhythm. So now I'm going to listen to your lung sounds. I'm going to have you sit up. Okay. Do you smoke at all?
No.
Okay. Not smoking is really good. If you start smoking, it can increase your chances of getting COPD, which stands for chronic obstructive pulmonary disease, and that can compromise your oxygen levels in your body and put you at a greater risk of developing lung cancer. So that's really good that you're not smoking, so keep up the good work.
Okay.
I'm really proud of you. Okay, so now I'm going to listen to his lung sounds. You can breathe normally. His lung sounds were clear bilaterally on the anterior aspect of his body. Breathe in. Breathe in. In. His lung sounds were clear bilaterally on the posterior aspect. So have you had a cough recently?
No.
Yeah. Do you have any problems regarding your heart or your lungs?
No.
Okay. Well, now I'm going to assess your abdomen, so you can go ahead and lay back down. So, can you tell me about your bowel movements?
Irregular.
Okay. Can you tell me what they look like?
Round and solid.
Okay. Now I'm going to inspect his abdomen. So there are no hernias or deformities present. His skin is clean, dry, and intact, and the color is appropriate for his ethnicity. Now I'm going to listen in the right lower quadrant. Listening for bowel sounds. So he had active bowel sounds in all four quadrants. If they were hypoactive or absent, I'll listen up to 5 minutes in each quadrant. I'll also touch my stethoscope to his skin, but since he's uncomfortable with that, we compromise when I'm touching it and I'm listening through his shirt. So now I'm going to palpate. Let me know if you feel tender or any painfulness when I palpate.
Okay.
Were you tender?
No.
Did you experience pain?
No.
So you have no tenderness and no pain based on palpation, and there was no distension or rigidity on palpation. So now I'm going to palpate your bladder. Was that painful or tender?
No.
Okay, so his bladder was not distended and non-tender and non-painful. So now I'm going to perform a GU assessment. So can you tell me about the characteristics of your urine?
Pale yellow.
Okay. How often you urinate?
Several times a day.
Do you have any rashes in your perineal or your genital area?
No.
Okay, well I'm going to look at your perineal and genital area as well as your buttocks, so please let me know if you're uncomfortable.
Okay.
So I'm looking for infestations, a rash, skin integrity, any foul-smelling odors, or discharge. I'm seeing if he is groomed appropriately, and I'm assessing his hygiene. So I see that his skin is clean, dry, and intact, and the color is appropriate for his ethnicity. There's no rashes or parasites or foul-smelling discharge or odors coming from him. And there are no parasites. And now I'm going to roll him. Ready? 1, 2, 3. I'm looking at his coccyx, his buttocks, his lower back, and his perineal area. There's no rashes, no foul-smelling odors or discharge, no parasites. His skin is clean, dry, and intact, and the color is appropriate for his ethnicity. There are no lesions or deformities as well. There are no parasites on him as well. And there's no rash present. There are no lesions present as well. Okay. So now I'm going to assess your lower extremities. So can you please roll up your sweatpants so I can look at your skin? Thank you so much. So his skin looks clean, dry, and intact on both extremities. He is warm to the touch bilaterally. Okay, I'm gonna have you lift this up. So his skin is clean, dry, and intact. The color is appropriate for his ethnicity. There is no swelling and there are no deformities present. You can go ahead and put that down. Okay. And do this one now. So the skin is clean, dry, and intact. There are no deformities present and the color is appropriate for his ethnicity. And there is no swelling. You can go ahead and put that down. Okay. Now assess your circulation. So his temperature was already warm, and now I'm going to do his dorsalis pedis pulses. Okay. They're equal and 2 plus moderate. Now I'm going to do his posterior tibial pulses. Equal 2 plus moderate. So now I'm going to look at his toes. His toes are well groomed and well maintained. There's no lesions, and his joints on his toes are not swollen, and his toenails are not clubbed. Now I'm going to do my capillary refill. Okay. His capillary refill is less than 3 seconds on all 5 of his toes on his left foot. So now I'm looking at his right. So his joints are not swollen, his toenails are not clubbed, there are no lesions on his skin present. Now I'm going to do capillary refill. Okay, capillary refill was less than 3 seconds on all 5 of his toes on his right foot. I'm going to assess for edema. There's no pitting edema present. His muscles look the same in size and symmetry, and now I'm going to assess his motor skills. So can you wiggle your toes for me? Okay, so it has full range of motion and it's fine motor skills. I can pull up on your feet, thank you, and then pull down like a gas pedal. He has equal and symmetrical strength. So now can you kick your feet like a bicycle? Okay, now the other way. Okay, so he has full range of motion on his fine and gross motor skills. His muscles are equal and symmetrical. And now I'm going to assess sensory. So I'm going to have you close your eyes and then you can tell me what toe I'm touching.
Pinky. Big toe. Big toe. Pinky.
Okay, his sensory is intact. So now I am going to palpate for any masses, lumps, and deformities. So let me know if you experience any tenderness as well.
Okay.
Are you tender?
Yeah.
No masses, no lumps, no deformities, no tenderness present. I'm going to do the other one now. Okay. So there are no deformities, no masses, no tenderness present. Are you tender?
Yeah.
Okay. No deformities present based on palpation. Okay. So now I'm going to have you put on your shoes. I'm going to have you walk to the end of that bed and then back into your bed. Okay, so he is independent. He has a steady gait. Do you have any questions or concerns?
No.
Okay, do you use assistive devices while you walk? Okay. Do you experience any pain while you walk?
No.
Okay, so now I'm gonna have you lay back down. Okay, here's your call light.
Thank you.
Your bed is in the lowest position. Your brakes are on. Your belongings are within
Thank
reach.
you.
You're welcome. Let me know if you need anything. I'm here to help you.
Okay.
And the bed is in the lowest position and the bed is locked. Okay. I'm gonna sanitize my hands before I go. Now I'm gonna document everything and my skills done.